We talk about long-term effects, meaning symptoms that start when you're getting a treatment but persist. And the classic example for anybody who's received paclitaxel is neuropathy. And then there are late effects, and those are the complications that may occur years or decades later. So we have to do something about that for surveillance and to keep people healthy.
So I'll be brave if you're brave.
So we talked a little bit, another thing you talked about where gaps in knowledge about what happens after cancer treatment starts, when it ends, or like anywhere, in the middle of that spectrum. And as people live longer, the impact it has on overall health. People are either on therapies for longer, as we see now, particularly with targeted therapies and immunotherapies, long-term side effects that sort of come along with that. And what you said to me is science is built around symptom management and survivorship.
Yeah. So the lung cancer community is catching up to the breast cancer community. We have kept our patients on maintenance therapies for a decade, for a very long time. And we have treated advanced or metastatic cancer for years and years and years, also with some oral therapies. And now the lung cancer community has more therapies that also are sort of given for longer periods of time and are helping to keep people well. When we study the science of symptoms and symptom management, we often talk, and forgive me now for going for a moment on a didactic here, we talk about long-term effects, meaning the symptoms that start when you're getting a treatment but persist. And the classic example for anybody who's received a drug called paclitaxel is neuropathy. And there are other drugs like platinum drugs and taxane drugs that can cause neuropathy. That may start with a treatment, but it may persist. And it's possible that some form may never go away. So those are all the long-term effects that are with you, fatigue and so on. And then there are late effects, and those are the complications that may occur years or decades later. Typically, if you think about radiation, if you radiate a part of the body, the esophagus, the prostate, for instance, there can be some strictures that occur just years or even decades after. Some drugs we give may hurt the heart many years later, so we have to worry and do something about that for surveillance and to keep people healthy. And now with immunotherapy that is so widely used and has been so helpful with lung cancer and other cancers, you can have toxicities that we never suspected before. Can cause, inflammation of the bowel, can cause the thyroid gland to shut down, it can cause the pancreas to be inflamed and cause diabetes, and so on and so on. And it can happen many months or probably longer afterwards. So I think that's the science of symptom management and the science of survivorship is based on recognizing, treating, mitigating, and perhaps someday preventing some of these side effects to make the physical toll of being on cancer treatment easier to bear. So that people can remain active and do the things they love to do, and and be as physically healthy as possible while we are also attending to cancer. So that's the bit of the art and practice these days, which is also why I'm such an enthusiast of good communication, because if there are physical symptoms, there is a science that is now mature enough to help deal with them, to address that fatigue, to address that neuropathy, to address the aches and pains and the problems. So, there's a lot that we can do. I'm not saying that it's going to repair everything, but there's a lot we can do to improve the symptoms, both pharmacologically and non-pharmacologically, which brings us to behaviors and the mind.